welcome. We're here today to talk about the Domestic Violence Prevention Fund request for proposals that we issued a few weeks ago. It'll be 3 weeks ago tomorrow. And there are also 3 weeks from tomorrow is the deadline for proposals. So thanks everyone for joining. Just sharing a little bit of background about the DVPF. That's the abbreviation. So you'll hear me say that a lot today. And this particular request for proposals is focusing on the community microgrants, and I'll walk through what those look like and those details in a moment. But just some background, the DVPF is a legislated fund. So it was passed through the General Assembly, through legislation. And if you look at the RFP, the actual text of the bill is linked there if you're curious and want to read it through. We introduced it 4 times to the Rhode Island General Assembly, and it finally passed in July of 2016. In addition to being legislated, it was established through the state budget and does have to be renewed each year. So we have ongoing work to preserve and make sure the DVPF is level funded each year, and to, of course, increase the amount over time. So that's part of our advocacy strategy for domestic violence prevention. And then in 2018, the fund was renamed the Deborah DeBear Domestic Violence Prevention Fund after our longstanding executive director, Deborah DeBear, who transitioned out of the coalition a few years ago, but had served for, I think, about 22 years in that role. And you'll see that awesome graphic has photos of some of the projects from the past, highlighting some of the great work that's been done in the community since the fund was passed in 2016. How do I advance my slides? There we go. So when we're thinking about the Domestic Violence Prevention Fund, the spirit of the fund is really focused on primary prevention. So this slide talks a little bit about, which I'm sure many of you are familiar with, the different levels of prevention. So when we talk about domestic violence prevention, we can be talking about so many different things, including tertiary and secondary prevention, which are focused on lessening the negative impacts over the long term after someone has already experienced domestic violence. So that might be police protection, counseling services, emergency shelter or transitional housing, and secondary prevention, again, aiming to reduce the impact of violence that has already begun, that has already happened. Services and supports like support groups. And then when we think about primary prevention, we are thinking about strategies to stop domestic violence before it starts. So another way of thinking about that is children who are born tomorrow. How do we create a world? What do we need to put in place that is going to change our communities in positive ways so that children born tomorrow never witness abuse, experience it, perpetrate it, preventing abuse before it even happens in the first place. So not only decreasing the risk factors that make it more likely domestic violence is going to occur, risk factors like economic insecurity, homelessness, poverty, but also create safe, supportive, protective environments that will decrease the likelihood violence will happen at all. So that's really what the spirit of Domestic Violence Prevention Fund is. And of course, there's some overlap between these layers. They are not, they don't exist in silos as we're actually doing our work and moving through the world. So there's certainly some overlap, but our focus with DVPF is on primary prevention. I will mention that the coalition has been the recipient of Delta funding from the Centers for Disease Control for many years, since early 2000s when the Delta funding first became a thing. So we've been really fortunate to receive that funding for almost 20 years now. And that's really where the DVPF was in part born out of, was the work that we have been doing funded by CDC. Again, that funding source focuses on primary prevention, the first federal funding of its kind in the early 2000s, and really has helped support Rhode Island build capacity in a public health approach to prevention. So again, a little bit of what I just spoke about, decreasing risk factors that make violence more likely to occur and enhancing protective factors. And 2 of the resources we link to in the request for proposals is the social ecological model, which is that nested graphic on the bottom left. and the social determinants of health. And these are both key pieces to a public health approach to violence prevention. I'm sure many of you on the call are familiar with them. And when we're thinking about DVPF, we're really looking at how can we put strategies in place that are going to impact an entire community, an entire neighborhood, an entire school community, in order to sustain the work over time. If we build it into our organizations, if we build it into our institutions, it's less likely to, evaporate if funding goes away. We're building it in to what already exists. We're building it into policies that will exist, for a long time into the future. And these strategies will, if they're on the community and societal levels, what sometimes we call the outer layers, since they're on the outer layer of this graphic, we're going to reach more people with that same amount of resources than we would trying to reach every individual one at a time. So we really focus on community and societal level prevention, and CDC has really been pushing us in that direction as well through our Delta work. Social determinants of health is a really interesting way to think about prevention as well. The amazing work that's being done through the health equity zones in Rhode Island, which is a pretty unique opportunity we have in our state, and amazing infrastructure for health equity that we have here that many other states do not. Looking at things that you might not think off the top of your head have anything to do with domestic violence, something like greening our communities, ensuring there's more access and more, just quantity of open space, green space. You may not think, off the top that has something to do with preventing domestic violence, but public health science shows when we have more green space, when there's fair and equitable access, folks feel safe and can access, parks, community gardens. Children have safe places to play. We have places to rest, relax, and spaces for recreation. Rates of violence actually go down in those communities. So when we're thinking about social determinants of health, we're thinking about things like, as you see in that graphic, economic stability, living wage jobs, again, neighborhood and built environment. So that's where green and open space would fall in, access to education, and also social connectedness and community connectedness. Something we often don't think about is science studies show that medical care, healthcare, clinical care is estimated to account for only about 20% of health outcomes, positive health outcomes. The remaining 80% really lives with these social determinants of health. These are the things that determine our health and well-being. So if we focus on these in these areas, that's how we can also address violence and increase, health promotion. And that doesn't mean that clinical care, medical care, obviously we need all of those things too. But this is a way that we can really invest in the health and well-being of our communities and be strategic about our resources, especially when we have limited resources to address violence in our communities, as we are all very well aware. So how can we be strategic about how we use them? And I forgot to mention on the previous slide, the Domestic Violence Prevention Fund is a $200,000 annual fund, and the coalition administers the DVPF and receives 10% for our administrative, administration of the grant, leaving $180,000 annually for the grants, the community grants. So not a lot of funding, but we're really grateful to have it. It's the first funding of its kind in the state, and that's why we're working diligently to try to increase the fund over time. I'll stop there. I don't see any activity in the chat, but please feel free if you have any questions along the way. So what do these kinds of strategies look like? One example that we like to lift up is our engaging men work. And the coalition has a strategy called 10 Men, which many of you may be familiar with. And we like to lift this one up because it shows the overlap between those different levels of prevention, but within a primary prevention focused strategy. So 10 Men, of course, includes some elements of educating local community leaders, local men who want to play a part, who want to be allies for gender equity, and haven't been sure how to get involved, haven't been, this is an invitation to be involved in the movement to end violence. And there are, of course, elements of educating men in the community about domestic violence, about this issue, and supporting them to be bystanders when they suspect incidents of violence or witness incidents of violence. So that is, of course, a component of the work. And that's nested within this broader strategy to have men not only think about domestic violence specifically as an issue and what they can do to respond when it's happening, but changing the norms that perpetuate it in the first place. And so thinking about masculinity norms, the culture of masculinity, going out into their workplaces and ensuring there are policies in place for survivors, that they're trauma-informed workplaces. As you see on some of these photos, we had a 10-man member speaking to his workplace just about the work of 10 men and masculinity. Members speaking to his congregation, his faith community. We've held community conversations. And then there's also an extra layer of public awareness campaigns and strategic communications with local journalists and other media tactics. And so there isn't a piece about addressing the issue of domestic violence, and that's within a broader strategy that also touches on all of these other layers of prevention. So it's one that we like to lift up because it shows these are not separate and apart from one another. The pieces where we're educating folks about warning signs and about the issue that might be considered secondary prevention, but this is nested within a larger strategy considered primary prevention because of that social norms change, that community connectedness piece, and having the public awareness campaign and strategic communications tactics layered over it so that not only are we reaching the men themselves and then the folks they are reaching when they go out into the world, but we're reaching larger swaths of the population through public awareness campaigns and media buys. All right, getting back into DV Prevention Fund specifically, the goal is to really increase the number of schools, groups in the community, organizations in the community who are working on primary prevention of intimate partner violence. Another goal is addressing disparities, so groups that may be experiencing intimate partner violence at higher rates than others. And those include youth of color, LGBTQ youth, Two-Spirit youth, and gender nonconforming youth, and youth with disabilities. And we've looked to data from the Youth Risk Behavior Survey in particular and other data that we have access to be able to understand which groups are experiencing violence at higher rates than others, and really prioritizing and centering those communities. And you see that photo of a group of youth that was engaged through Progreso Latino's Domestic Violence Prevention Fund project. Another area we lift up in the request for proposals is the Lindsay Ann Burke Act. Lindsay Ann Burke is on the bottom right of the screen in that photo, and was tragically killed by her dating partner, I believe an ex-dating partner, in 2005. And the following year, her mother, Ann Burke, was an amazing champion in the wake of that tragedy to mobilize and advocate for the passage of the Lindsay Ann Burke Act. That was the first law in the country, really a momentous moment, a momentous law that led to many other states. I think at the time that we published our evaluation report on how well the law was being implemented, I think 21 other states had passed a similar law. And it mandates that Rhode Island public middle and high schools have policies in place to respond to incidents of violence and train all school staff on dating violence. And the bottom left is a cover image of the cover of an evaluation report that Cynthia, who is on the call, led with our leadership team for prevention, looking at how is the law being implemented and how can we strengthen its implementation, I think about 10 years after it had passed. Charahoe High School is pictured on this slide as well, because we lift them up in the report as a model for how this law can be implemented, not in a comprehensive way. So having policies in place, having adequate, robust staff training, and doing other things like a theater project that they had with their students to, again, address norms and promote healthy relationships. So really working on multiple levels in the school community to address not only teen dating violence, but multiple forms of violence as well that share root causes. So we lift this up in the RFP as an opportunity. We have this act in the state. All public middle and high schools need to be compliant with the act. And it really gives us a strong foundation to work with schools, to work with parents and other members of the community to ensure that we're responding to dating violence. And again, creating safe, supportive environments where dating violence is less likely to occur in the first place. Through the DVPF, direct classroom-based education is not an allowable use of funding because the Lindsay M. Burke Act already requires that. So that would be a duplication of services. So other ways that we can strengthen its implementation would be through things like school climate change strategies and school systems change strategies. So those might be working with administration to ensure the policy exists, it's up to date and aligned with best practices, and it's being implemented well. Training staff on the policy, training staff on teen dating violence, and again, on all of those protective factors that help prevent it from happening in the first place. And awareness and media campaigns, so positive social norms campaigns, which might show data from the student body saying most students, most students believe in healthy relationships. And the photo on the bottom left shows a submission to the poster contest that Lindsay M. Burke Memorial Fund runs every year. And this was one of the top participants. So something like that, where you're engaging students in creating artwork or telling their stories, and not only having awareness campaigns in the school setting, but engaging students to create that, to co-create what that looks like. Something else might be community organizing strategies. Every district is required to have a health and wellness committee. Some are more active than others, and many often focus on physical activity, nutrition, that kind of health and wellness. So working with your district health and wellness committee, figuring out how often they meet, how active they are, and helping them understand that health and wellness is not only physical activity and nutrition, but broadening it to be even more comprehensive and including violence prevention, healthy relationships, working with parent organizations, working with athletic programs. Again, thinking about what is already happening in your community, in your school community, in your district, and building on what already exists, filling some gaps and building on that existing infrastructure. So that's why we lift up Lindsay M. Burke Act throughout the request for proposals as one possibility for domestic violence prevention fund projects. Here we have a slide that shows all of the organizations that have been funded by DVPF thus far. We do have another category of grants called implementation projects, and those are larger in scope than the community micro grants. They're multi-year projects that are funded across about 3 years. And those have been awarded to those 4 organizations listed: Progresso Latino, Sojourner House, Noel Leadership Academy, and YWCA of Rhode Island. And many organizations have received community microgrants, which are shorter term one-time grants. And that is what we're on the call to talk about today. That's the current request for proposals is focusing on community microgrants because the implementation projects are currently underway. And I believe those will run through 2023. And at that time, we will reopen the RFP for both kinds of grants. And the implementation projects will again be awarded at that time. So you see all of these different organizations from Rhode Island who have successfully applied and received DVPF funding. And I will let folks know on our website, ricadv.org/DVPF. I think I can figure out how to put it in the chat without messing everything up. These organizations are each listed with a little bit of a blurb about what they focused on, what their project aimed to accomplish, and what that work looked like. If you are looking for examples or just more information about what has been successfully funded as you're thinking about your proposals. Now we're turning to the information that is contained in the RFP, just so we can talk through it and walk through it. And this might be where some folks, where some of your questions might come up. So feel free to unmute and ask questions or put them in the chat. So this year we have a total of $78,000 to be distributed in support of one-time community microgrants. Your proposal can be from requesting $1,000 up to $15,000. So that might be if you already have an existing project but just need some additional funding, you might be on the lower end. Or if this is, going to be the primary source of funding for your project, you might be on the higher end. So that is the range. Projects will be completed by June 30th of next year. We align with the legislature's fiscal year since it is a state-funded legislated funding source. So that's where the June 30th date comes in. And community microgrant funding, unlike the implementation project funding, cannot be used as startup funding for new programs. It has to supplement or enhance something that already exists. And again, that's because they are one-time short-term projects. So we need to be able to, there's not as long of a window for planning, assessment, piloting that happens with the implementation projects that go across multiple years. So you're really diving right in, able to apply the funding right away in order to have success over a fairly short, depending on what the process has looked like, they've been 6 to 10 month grant periods, and this one should be about 8 months. So that can look like different things. If you have questions about, is this considered startup, or is this, it's really thinking, is there infrastructure in place? Are the partnerships in place? Has the organization been doing similar work? Is this building on something that already exists rather than starting from scratch? In terms of eligibility, who can apply for DVPF funding? Public and not-for-profit community-based organizations, faith institutions, Rhode Island middle and high schools are all eligible to apply. Only established 501c3 organizations that have been operating for at least 2 years will be considered. And community groups and associations that are not 501c3 or have only been operating for less than 2 years can use a local fiscal agent to apply. And we have had at least one project that I know of where an individual was really the lead applicant and partnered with a local 501c3 as their fiscal agent. So that has happened in the past. Again, due date for proposals. I see Deb has a question. So we will get to the priority populations in a moment, Deb. It is not limited to programs for youth, although that is the priority populations that are outlined in the RFP. So that doesn't mean that folks cannot apply for another focus or another audience, but that is those are the priority populations. Our youth of color, LGBTQ and gender nonconforming youth, and youth with disabilities. Although we have had projects funded that may not have those as their priority populations, or that is just one element. And again, if you look on our website, you'll be able to see what those projects look like. So it's not limited, but those are the priority groups. Again, the deadline 3 p.m. Thursday, October 7th. I believe that is 3 weeks from tomorrow. The application process is streamlined, just to email right to me at my email address in PDF format. And we ask that they are not scanned images of text, which just means that we'll be able to select the text within them in case we need to copy and paste anything. If the project is to be funded, it's really helpful to be able to copy some of the language as we're communicating outwardly about the projects. And again, you'll see that photo in the middle is the evaluation report that Cynthia, our evaluator, led the creation of a few years ago, which looks at the implementation of the Lindsay Ann Burke Act. That's in the middle there. And on the left is a publication that we put out highlighting primary prevention strategies, what those can look like in the community. And on the right is the technical package, they call it, from CDC, which looks at primary prevention promising practices for intimate partner violence. And again, a lot of what the RFP is based on and our ongoing work in Rhode Island is based on evidence-informed and promising practices from the CDC. So that's a very helpful resource as well. And related to Deb's question, if you look through our primary prevention publication, the one that's Our Future Depends on Preventing Domestic Violence, you'll see a lot of other strategies that may not be youth focused, but are still considered primary prevention, and that you might be able to build in an element of reaching and engaging some of the priority youth populations in your project, even if that is not the sole focus. So now we'll walk through these different sections in the RFP. This is the scoring criteria table. The first category is knowledge, experience, and referral capacity. In this section, you're going to want to describe your organization's understanding of the dynamics of intimate partner violence and your staff capacity to refer victims to services and supports. While your project is focusing again on primary prevention strategies, this again speaks to the overlap where as you're doing this work, more likely than not, you will have to speak about the issue of, speak to the issue of domestic violence, have some knowledge of the topic, and folks may disclose or may come forward when they know you are working on domestic violence prevention. So having that in place is also really important to be able to support folks who need to be referred to services and resources in the community. Also in this section, you would want to describe any history you have as an organization working with the priority populations and indicate if you are a previous funding recipient of the DVPF. Previous funding recipients are, as of now, still eligible to reapply. That may change in the future, but right now, if you have received funding in the past, you are eligible to apply again. And if you have previously received funding, we just ask that you describe what you've accomplished in the past as a funding recipient, how this application builds on those previous activities, and why funding is still needed. So making the case for that funding. In your work plan, this is pretty open-ended. It can look like whatever you want it to look like. You can include a table if you want, organize the information however you'd like. But the focus is describing your goals and objectives for the project and what the activities will be to reach those goals and objectives. What are the intended outcomes for the folks that you are planning to reach and engage with your project? What are you hoping those outcomes will be? And describing, again, the work plan and timeline. So goals, objectives, activities, and along what timeline in this grant period those will take place. This one is, I believe, the highest number of points on the scoring criteria. So it has the work plan section has a good amount of weight. So you'll want to spend some time on this section and give this section some attention. Make sure it hits all of those pieces. But again, the format of the work plan section is up to you. Community connection and ownership is worth 15 points in the scoring criteria. And this piece is thinking about how your project will help community members make a personal connection to the issue and encourage bystanders to get involved. And you'll also want to describe what percentage of the community's population you anticipate to reach. So how many folks will be engaged? A good example of this is the Signed X photo exhibit that was a recipient of a community microgrant through, I believe day one was the fiscal agent and the lead applicant was the statewide campus collaborative for sexual violence prevention. And they did a photo exhibit, a traveling photo exhibit a few years ago prior to the pandemic. So even though it wasn't, a program where it was not focused on educating folks about the issue or providing services, but through that art, through those photos that focused on survivors, portraits of survivors, and then the events and conversation that happened around those exhibits, folks were able to make a personal connection to the issue of domestic violence. So again, within the scope of primary prevention, But that doesn't mean, there isn't still a connection to these issues and a call to action for bystanders in the community to get involved in whatever way they can. Again, as I've mentioned a few times, the priority groups for the RFP worth 10 points are youth of color, LGBTQ, two-spirit, and gender nonconforming youth, and youth with disabilities. So again, it's 10 points, and we also ask in the knowledge, experience, and capacity section to outline any past history your organization has working with these groups, but is not a limitation or a restriction to only propose working with these groups. And again, it comes from looking at data in Rhode Island of who is most impacted by intimate partner violence. And even CDC lists just being a young person as a risk factor for intimate partner violence. So thinking about that, that is what led to the creation of these priority populations in the RFP. And here you'll just want to describe what your proposal's priority population is and why, even if it doesn't fall within those groups. Empowerment approach is 10 points. And this is thinking about how is your project centering the voices and experiences of those most impacted by intimate partner violence, by systemic oppressions, including racism, and by inequities. Those are the root causes of intimate partner violence, those power imbalances in our society, and those inequities that exist, again, thinking about the social determinants of health, access to housing, livable wage employment, education, healthcare. Of course, those are shaped by inequities that exist in society. So an empowerment approach is really thinking about not having a top-down approach where we have the answers, we have the program, we have the solution for a particular community, but listening, again, using data, using both qualitative and quantitative data, listening to communities, listening to their stories, and partnering with them to co-create these strategies and working with them as partners in prevention. That can look like a lot of different things and can be done in many different ways. But those values and approaches we are aspiring to have at the heart of DVPF projects. So again, centering the voices and experiences of folks most impacted by violence and inequity, and creating change that's going to lead to more just communities, more healthy communities, more inclusive communities. By doing so, we will decrease rates of violence over time. And so we ask in this section for you to describe how your organization as a whole or your project in particular values this approach and plans to apply it. And 10 points for the budget and budget narrative. We do provide a template in the request for proposals that you can use. That's for the itemized budget. And for the budget narrative, you'll just want to walk through what each of those line items is speaking to and how that funding will be used. And we ask, our hope is that the grant period will begin on November 1st. So that I have a slide, I think might be the next slide, or a slide coming up talking about the grant making process. So we hope to be able to make decisions on the awards. The committee, which I'll speak to in a moment, will be able to make decisions on the awards and let folks know by before November 1st, by Halloween, by October 31st, if they have been awarded, so that the grant period can begin on November 1st. And again, it will run through June 30th of next year. If that changes, we can adjust the budgets, but for your proposals, if you can submit an 8-month project budget starting November 1st and running through June 30th. I also have a note here that the DVPF is a reimbursement grant, and that is helpful information for folks to know that we receive funding from the state after submitting the documentation that shows how the funding was used. And that's fairly common. It's not always the most supportive way of having this work be funded, particularly for small and medium-sized organizations. So that's something that we are aware of, that can be, not a very supportive practice. So I did want to mention that just so folks are aware that you would, as a successful applicant, submit fiscal reports to the coalition. We then submit those to the state and we are reimbursed, and then we reimburse the funding recipients, which can take a fairly good amount of time. The state can move somewhat slowly. So wanted to be transparent and let folks know that the DVPF is a reimbursement grant. Again, this is the scoring criteria table. You'll see work plan has the most weight against all of the other categories. So you'll want to spend some time on that section. This is formatting requirements, making sure your proposals are typed, double spaced with 1-inch margins. The application is not to exceed 5 pages. See your question, Shale. Yes, we have it, I think, in the PDF of the request for proposals, but I can certainly make it a linkable document that you can download. I don't have that right this moment, but I can share that with the group. Just make a note of it, because if I don't write it down, I won't remember. I will share that with this group by email, and we can also post it on our website. Just so it's really clear, it'll say just budget template, so you can just click on that and download it. The application is not to exceed 5 pages, but that excludes the cover letter, the budget narrative, and any optional attachments. We've received some feedback in the past. I think everything was included in that 5-page limit, which made it very difficult to have a descriptive narrative where you could really share and make the case for your project. So that's a recent change where it's excluding those other pieces. So the narrative itself, all of those elements that we just walked through, would be within that 5-page limit. And it also needs to include a signed cover letter on official organization letterhead, signed by someone authorized to sign on behalf of the organization, and include primary contact information so we know who to reach out to, email, phone, and mailing address. Here's the grant making process I alluded to earlier. So wanted to let folks know the coalition provides technical assistance and support to the advisory committee and to potential applicants, but does not have a voting seat on the committee. So we are the administrator of the grant and can provide that technical assistance. That's why we lead these calls. We can answer any questions. When it comes to the actual grant making process and decisions made on proposals, that is held by the DVPF Advisory Committee. So every proposal we receive will be reviewed, and this committee ultimately scores the proposals and makes the decisions. The committee was created through the DVPF legislation. So you'll see, if you look at the language of the legislation, you'll see that outlined there. And it is made up of members of the coalition's board of directors, as well as directors of several state departments or folks that they designate to serve on their behalf. And right now it includes Department of Health, the Department of Human Services, the Office of the Attorney General, and the Office of the General Treasurer. So we will convene that group in mid-October once all the proposals are in. Every proposal will be reviewed and scored, and then that committee will make decisions. And then the coalition will be in touch with successful applicants, as well as we will contact everyone who submitted a proposal so you know what the outcome of the process has been. So you will hear from us no matter what. We also can provide feedback for folks who were not funded to strengthen future proposals. And that's something I would put in my communications to anyone who isn't funded. If you would like, a more in-depth call where we can share some feedback on your proposal, that's also available. All right, I think that was my last slide. Here's the due date again, just so folks have that front and center. Open it up for any other questions. And I also want to welcome folks to share feedback either on this call or directly with me after the call, after the process, during the process. We're always looking for ways to continuously improve how we administer the fund. So if you have feedback on this presentation, on the process, what would be supportive for prospective applicants in the future on the grant program overall. We're always wanting to hear that feedback and wanting to hear from everyone in the community about how we can strengthen the DVPF and how it's being administered. So I wanted to make a plug for that as well. I'm gonna stop sharing. I wanted to make sure no one was in the waiting room that whole time, but no, we're good. And okay, yes.
Sorry, I was just going to say that there's a question in the chat.
Cool. Let's see. Is that one from Shael about the budget template?
Yeah.
Okay, cool. I think I addressed that, but just to reiterate, thanks, Devin. I will share that with the group and I'll make sure it's posted to the website too. And we'll open it up for other questions. I see Jean has one about attachments. So yes, we've received one of the proposals was around an app that teens could use to learn about healthy relationships and take action as bystanders. And so we've received attachments with screenshots of the app to show how that might function. I'm trying to think, that's one that comes to mind. If there's a certain, curriculum that you might use, maybe showing an example of what that's looked like, one of the activities that you might work, walk through with a group of youth. Anything that you feel is going to give that sort of texture to your application and bring it to life a little bit more that a written narrative might not do as well as maybe a photo or an outline of some materials. Public awareness campaign, an example, even if it's just a mock-up or an idea, or another awareness campaign that you're going to model yours after, something like that. Shael, can that include links to videos? That's a great question. I think I say, why not? I love, we're always interested in using videos to bring things to life and tell stories. So especially if you're going to be using that in some way in your project, or again, it tells the story of your organization. I would say, definitely include it. We will share the proposals via email with the committee. So they should be able, they're not going to get a packet of printouts. So they'll have the digital version and they should be able to click on those links. I would try to keep them a little bit short because there's no guarantee that every member of the committee will watch every video, but we will certainly pass them along and I will definitely watch all of them. Even though I don't get a voting seat, I still want to see all the materials submitted. Other questions related to the process, your applications, ideas that you have? I will share that we received 2 questions coming into the call. One was, I think it has been addressed, of can previous applicants reapply and receive funding again, which as of now, yes, there is no restriction against past applicants reapplying. And that is why that is another change we made this year in the knowledge and experience section, indicating that you are a past funding recipient and why funding is still needed, what's been successful, how is it building on past efforts, and why funding is still needed. And the other question was around, would a public awareness campaign fall within the scope of DVPF with a focus on encouraging bystanders to report incidents of elder abuse, which is, unlike intimate partner violence, is a mandatory reporting issue. And so my response to that question was public awareness campaigns definitely fall within the scope of DVPF. Something so specific to reporting incidents would not be considered primary prevention, but there may be other ways to address that issue, change norms, engage bystanders. But you wouldn't want it to be so focused on reporting incidents, since that would fall outside of primary prevention. But a public awareness campaign about breaking isolation, reaching out to elders, creating that connection, those may fall within the scope. Can funding be used to develop websites? I think that is maybe the first time we've been asked that question. Again, I think if it falls, if it's not a startup, program, if it's building on something that already exists, and if the focus of the website falls within the scope of primary prevention, then I think absolutely that would be a possibility. I see Helene's comment. I'm grateful to be able to pivot and use microgrant during the pandemic. Yes, so Partnership for Providence Parks, which Helene represents, thanks for joining, Helene, was able to submit, they were successfully awarded funding for an amazing proposal, and then the pandemic hit last year. And so the partnership pivoted and did a really awesome project putting art kits in the hands of young people. And there's a description on our website and some photos. I'm not doing it justice. I want to tell the whole story, but there isn't time. But one question that Helene had is, can we submit our initial idea that wasn't able to come to fruition because of the pandemic, update it, tweak it a little bit, and submit it for this funding cycle? And I think absolutely. Again, telling a little bit of that story of what the original vision was, why it wasn't able to get off the ground because of the pandemic, why it's probably even more needed now than ever because of the impacts of the pandemic. I would just add a little bit, more than you had last year about what that story is. And it was successfully funded once, so hopefully it would be again. And I think that would go for even projects that have been submitted in the past and not funded. We've had some feedback calls where we've been able to share feedback from the committee. We're able to be in the room when they're making their decisions, answer any questions, and then we're also able to hear their reasoning about why they're making the decisions that they are. So some of those feedback calls we've been able to provide that information. And one applicant who was obviously disappointed that they weren't funded, some of the feedback was the committee didn't know, did you already have partnerships with the schools that you mentioned? This was actually the piece for the app, giving teens access to this app, and it had a community engagement component where they would work with local businesses, and they could be part of sort of an awareness and community project. And the committee was wondering, this is going to be a lot of work to establish these partnerships if they're not already in place. We all know how hard it can be to find who to even speak to at a school or build those relationships. It takes a really long time. And so that was the main concern, was, can you get this off the ground in I think that grant period was 6 to 8 months around what this one will be. So that was the main concern. That will be a lot to put into place. You might only just be starting to build those partnerships by the time the grant period ends. And the applicant said, oh, I wish we had put that in there because we have these partnerships in place. They're already ready to go. They're already lined up. So I would say, especially in the knowledge and experience section, or even in the work plan section, if you can share a little bit about, again, this isn't startup funding, this is building on what already exists, share a little bit about how it builds on what's already happening. So the committee feels confident that, okay, you can kind of hit the ground running, you have those partners in place, you have the infrastructure, will be more likely to be successful rather than starting some of that relationship building from scratch. So I think that's an important piece. All they know is what's on the page. They don't do any additional research, or you're not in the room to be able to make your pitch. So I would say whatever you put in your narrative, try to tell that detailed story, because that's all that they're seeing is what's in your proposal. Other questions, if you want to add to the chat or unmute and ask, feel free. We've got a few minutes left. Folks are also welcome to email me in the coming weeks as you're continuing to work on and fine tune your proposals. And I will likely post any questions we receive via email with our responses to the website as well, so other applicants can see those. So check back, because we'll be updating our website with any other questions that come in. Thanks, Rachel. I'm glad it was useful. In the past, we've had a conference call. This was pre-pandemic and before Zoom was so commonly used. So it's nice to be able to do a Zoom call, see folks' faces, and share some slides. Any lingering questions, thoughts? questions, comments? See some folks are starting to hop off. Again, I will put my email. I think everyone has it since you all signed up for this call, but feel free to reach out with any questions in the coming weeks. October 7th at 3 p.m. is the due date for proposals. And I'll just thank everyone for tuning in, for your time today, and for your interest in the Domestic Violence Prevention Fund. It's really exciting that we have this funding available and that we can do this great work in the community to create environments where violence is less likely to occur and put some supports in place for community members so everyone can be safe and reach their full potential and thrive. So that is the spirit of the DVPF, and we're really grateful to have your interest, your participation, and stay in touch. Let us know how we can support you along the way. And thanks for tuning in today.